Hey guys, happy Wednesday. I'm headed to my pain doctor's appointment. They got me worked in so I could talk to her about I don't want to be on the Percocet anymore. I still have some left, so if I ever have to take it, it's because I'm in like a super horrible flare. I want to go back on my Norco. I brought the prescriptions back because I never filled them. I've had issues with the amitriptyline. She said that it shouldn't be able to cause pain or issues with my kidneys, but it does. Like, I have constant like bladder pain and my urine's always dark. It's not right. So I stopped it a couple days ago and I felt okay, and I took it last night and I woke up back with the same pain. So I'm not going to take that anymore. So we're going to come up with a game plan, because when I leave for 10 days, like, I have to know what is best and what we're going to do. But part of the other reason with the pain medicine, I don't want anything else to affect my lungs. And I'm on such a low dose of the Norco. I can take a half if I have to. Like, it's been very hard because the pain has been pretty bad. Like, as long as I'm up moving, like the first part of the day, but when nightfall, I feel like every muscle just aches from everything that you did. So I'm just trying to be more proactive when it comes to my body. I just gotta do something. But like last night when we got home from track, I did okay at track because it wasn't hot. Like, it had just rained, so it had to be like in its 70s or so. The sun wasn't out because it was really cloudy. Excuse me. So I was able to help with the entire fun meet that we had with no problems. But by the time I got in the car, my head, it was hurting, but it wasn't like a migraine. But by the time I got home, got showered, and then I had some cereal because that's all I felt like eating, my head was throbbing. So like, the light was killing me, everything. And so I took my Fioricet that I take for migraines, and matter of fact, I still have the bottle from last year, and my refill expired this year, so I'm gonna have to get a new script on that. But it lasted from about 7 till about 1 o'clock, and normally when I take the Fioricet, within an hour and a half, it knocks it out. It did not do that. So I was just like, finally, I could have took a second one at that point, when it wasn't gone, but I never take two. And about 3-4, it was gone, so I thought. But then I got up, got my shower, and now I feel it coming back. So I don't know. I'll talk to her about what's going on with these headaches and the dizziness, since my blood pressure was high. I don't know what's going on. She may tell me I need to go to my primary. I have no clue, but we shall see. But yeah, I just wanted to tell you guys that's what we're doing this morning. And then when I get back, I'm going to do a clean with me, because my family will be in town tomorrow and my house still looks like crap. I did clean the kitchen, but that was it. Like, the guest room, my husband had to put a nightstand together. So he had stuff all over the floor, but he finally finished that the other night. So I just got to clean that up. He's working on the second guest bedroom, because that's where we dump all the laundry for Easter, because we wash Easter's clothes every day. Sorry, somebody was calling in. But yeah, so that's the plan for today. And then I have to meet with the banquet committee to go over, we're going to go look at the venue. I've already seen it and done the deposit, but they have not seen it. And since they're the ones that's really organizing it, they needed to look at it. So we're going to do that today. Along with, I think that's it. When I get back home, I brought some purple whole peas and field peas. I'm going to cook that in the crock pot. I need to call my husband now and tell him to put that on. So let me focus. I'll come back after my appointment.
I'm doing well. How are you?
Okay. Better than I was.
Yeah? Oh, that's good to hear. Fill me in.
Okay, so the day I was here, that's when the Manjaro dose
Yep,
pack.
yep.
So
exactly.
I took it, but I always forget. By day 3, every time since I was little, took steroids for asthma, I would get severe muscle pains in my shoulder, my back, to the point you could barely touch me.
Oh my
And I
goodness.
forgot Dr. Harris mentioned a couple years ago, well, before I started seeing you, that I had muscle myopathy from it, and it's rare, but it happens. And I'm thinking, like, well, heck, that's why all these epidurals are not really helping, because, like, I feel so much worse.
Yeah.
It's the steroids. So I'm just at a point to where, of course, I won't do any more steroids if I can all help it.
Yeah.
But I don't want to do the Percocet anymore.
Okay.
So I brought this. I didn't feel it.
Okay.
So I brought it back, and I just wanted to prefer to go back to the Norco. I have my bottle. I think the last time was filled was in February when Dr. Mullins gave it to me.
Gave it to you.
So that's what I have left from that
Okay.
trip. Because even when I left here, I didn't even take any more of the Percocet. Like,
Okay.
I was just
Done with it. Huh?
yeah.
Enough.
I have to just figure out different methods of trying to just deal with what I have to deal with on an everyday basis. And I don't want to go any stronger on narcotics because of my breathing and everything else and what I had to go through before. I can't go
Keep
through
doing
that.
that.
So I know you gave me the it was like a compound cream before,
Yep.
and I was wondering if I could go back to that.
Absolutely.
I think Jackson Pace has a compound pharmacy that they could do it. I don't know.
Oh, really?
Yeah, so I'll have to find out.
Okay. Usually they have
I went to that one on Davis, I think.
the Smart Pharmacy.
I think that's what it was called.
Yeah, so that pharmacy actually will mail it to you.
Oh, okay.
They usually contact, the way it works, and typically the compounding pharmacies, if they can do it, they'll have like a prescription almost that you can kind of select which medicines that you'd like to mix into the cream. And the way that Smart Pharmacy works is they have one of those things, and we can just check what we want.
That works.
And they usually contact you to let you know how much it's going to cost before
They actually fill it.
filling it.
Gotcha.
And they'll mail it to you if that's convenient.
Okay, either or is fine.
Okay, whatever you like.
Yeah, they can contact me. I mean, Davis is that far away.
Okay.
So.
Okay. Yeah, we can certainly do that. Okay. And the amitriptyline, how's that going?
I told him, because when I told you before, like I was having the kidney pain.
Yeah.
And we didn't think it was that, but I stopped it like Saturday, and the pain went away. And then I was like, well, let's see. And I took it last night. It's back.
No kidding.
It's back. And it frustrates me because it actually works for the neuropathy.
Yeah.
But I just can't do it. Like,
so it's like causing kidney pain?
it's actual kidney pain, and like my urine is like super, super dark, which that was the whole thing. I'm like, is it because the prednisone made my bladder like do some crazy stuff?
Really?
Yeah, so that's why when I researched the muscle myopathy, like really paid attention, I was like, it's like if it's gonna happen, it'll happen to me. So.
Oh no, yeah, we don't want that.
Yeah.
Okay, and you are, so no more amitriptyline, no more Percocet, and are you taking the baclofen still?
I do.
Okay, how's that one going?
It works.
Okay, so no side effects with that. So we want to stay on that one.
Yeah.
Do you need a refill of that? I'll send one just in case.
Because I think when I get it, it's like number, I don't know, 60 or 90 or something. But I don't take it 3 times a day ever. So
usually like 3 times a week, right?
No, if I take it, it's at bedtime, or if I'm in a flare, I may take a half one in the daytime when I'm not going anywhere, but other than that, I don't take it like that.
Okay. Do you feel like your pain overall right now is manageable?
Today, no, but I'm okay. Like, I'm just have to deal with it, because like what I've noticed, if I'm up moving, yeah, it hurts, but I just keep going and I'm okay. But it's nighttime where it all just like kind of caves down on me.
Yeah.
And I told him I think my body's just haywire because this is my first full month of no Benlysta. So I just think my body's just trying to
get adjusted.
Yeah.
Okay. I'm just wondering if there's anything else that we can do to help, your pain.
Yeah.
We've done water therapy in the past. That's always an option.
Okay.
If you'd be interested to do something again that's not really a medication.
Okay.
There are, and I know you do a lot of like self coping strategies. I haven't seen or haven't heard of any really good pain psychologists, in town. Although I know that some people have found really good benefit from books and online resources.
I just pray. And just, you know what I'm saying? I just don't want to get to that point, because like my husband was like, when I was in that horrible flare, he was just like, I know you're hurting, but just get out of the bed, or if you want to lay down, go lay down in the living room, because he's seen me to the point to where I'm in a flare, then I immediately start getting depressed because my life, it just alters, and I was like, I'm trying. He was like, I know you're hurting, but please just try to get up,
Yeah.
And so I just had to, try to just start making myself.
You guys are such a good team.
He's learned.
Oh my gosh, that warms my heart though,
Yeah, he cares, though. I don't know, I just have to figure out,
Yeah, absolutely.
And I think the pain cream, it worked. It was just like, well, if you're in a flare, I can't just put this stuff all over my whole body. You know what I'm saying? So, I mean, it did work.
Right.
I did not use it. I'm going to say they said 4 times a day or something.
Right.
I'd never use it. And it probably would have worked better if I did it 4 times a day. Because I would only do it like in the morning and at bedtime. And they were like, you really should, and I was
use
like,
it more
often.
Yeah. What have you thought at all about medical marijuana?
Dr. Brown gave me a brochure a couple months back. I didn't know how you felt because, with this whole laws and all this stuff. But when she told me the price, she was like, most of her patients that take it, it absolutely works for them, and they're able to come off certain medications.
Yeah.
But it's like $500 to $700 a month, and I'm like, are you kidding me?
Is it through her office?
No, it's through that place.
The medical.
True something.
Oh.
That one I know there's one like downtown area sort of.
Okay.
I think it's the only one that's here.
Okay.
I can't remember the name of it. She gave me a pamphlet, and I was like, well, how can you,
afford
I'm on disability, like I can't afford $500 for, you know what I'm saying? I was like, that's crazy, but I'm like, there are people, I have support groups that I'm a part of, and there are people that faithfully, use it, and they said it works, but I'm like, where are you getting that kind of money from?
Yeah.
And the insurance doesn't cover it.
No, not at all.
And I said, well, something that's a natural plant, I know people abuse it, but that's just crazy to me.
Yeah. I have had more and more people try it, and when I did my pain fellowship in California, so it's very prevalent there.
Yeah.
And it is a good option for people with pain that's just not very well treated by all of our more traditional medicines.
Well, I guess I could talk to my husband and call them. Do you have to refer, or can I call my? How does that work?
No, usually, I don't know the pamphlet that Dr. Brown gave to you. Usually, you have to get a card, and I can't prescribe it here, but I have people. There's the medical highway.
Oh, I don't know that one. Okay, this one is on like Davis, like going downtown.
Usually that's the only one that I am aware of, to send people to. They actually, so they have a physician there that will say yes, this is indicated, or no. And then they can help you go through the process of getting the card.
Oh, okay.
And then once you have the card, then they work with different dispensaries to be able to actually access the medicine.
Okay.
The one catch is, though, that typically people need to be off of opioid medicines in order to, try it.
Okay.
So that's just something to think about.
Okay.
And it, with the urine drug screens that we have to do, it's one or the other.
No, I understand.
So, but I want you to be on whatever works best for you. That's.
I mean, I've never done marijuana ever.
Yeah.
So
and it's not designed. They make it.
Yeah.
It's so super specialized these days that they have different strains of the plant that they've actually grown to be more, have less of the THC component that makes people feel high.
Okay.
And so they have very low levels of that and very high levels of the CBD1 and the CBD2 receptors that are the actual pain action, of the plant. So it's like a whole science behind it.
I know, it sounds pretty.
It is. It's pretty extensive.
So I didn't know anything about them. So do you contact them for me? Just do it, or I can contact.
Yep.
So I'll talk to my husband and see if a consultation to just see cost effectiveness.
Yeah.
And it's sad that you have to choose to say, well, I'm gonna have to be stuck with pain pills because I can't afford.
Right.
You know what I'm saying?
Right. Absolutely.
I'll talk to them.
They will probably have much more information
Yeah.
about it than I know. And I don't know if it's like a one-time fee or how much the actual card costs.
Yeah.
I'm sure there's hidden fees behind all of that stuff.
Because I like I said, I never heard of them. I knew it was that new one that is like a doctor's office and a dispensary in one.
Oh.
Yeah,
oh.
And I want to say their consultation is over $100 just for you to go in to see.
Okay.
If you could even, what I'm saying? And then I'm like, but when she said 5 to 7, I was like, I'm not going to go there.
Yeah, exactly. I don't hear anything else at this point.
But yeah, I'll talk to him and then maybe call or see how it works.
Yeah.
And then, let you know.
Yeah.
Or whatever. But
yeah. It sounds reasonable to me. Again, especially if you want to avoid all of these other medications and it can help with muscle spasms, with nerve pain, all sorts of different types of pain, qualities of pain that some of the medicines just aren't good to touch. They just, it's for one reason you have a side effect or it's just not effective, which is like we talked about these opioid type of medicines. It's one of the big problems. So I certainly think it would be worth it to investigate.
Yeah, I'll definitely do that. Because
Okay.
I even asked when she was mentioning it, I was like, well, are there any, like groups that will help, the ones that cover your prescriptions, do they help cover it? And they said no, because it's not FDA approved.
Right.
I just, I just feel like the government, it's like they have the opioid crisis and it's like they're trying to do all this stuff for people that are hooked on opioids. But I was like, it's all a monopoly because I was like, first off, the drug companies created that and they're going to create something for you to get off of it. But if you stop it, you're going to go back that way. So it's still making money for them.
Oh, yeah.
So, it's just
horrible.
sad.
It is. I'm with you 100%.
And it makes your job hard because they're changing all these laws. And I'm like, what does that leave? I know you have tons of people that abuse it. But I'm like, what does it leave with us with chronic illness that we can't help what we have?
Exactly.
Like, it's not going to just go away.
Yeah.
Yeah. So.
My goal, though, is to make it as easy as possible for you and for people like you to get what you need.
Yeah.
But if it's not working, we gotta...
And that's what my husband's like, I don't understand why you take it if it doesn't help you. And I was like, well, sometimes it takes the edge off. And then I can do a little bit more. But he's like, and he's at the point, he's like, they're pumping all these medicines, not necessarily here.
No, exactly.
My Lupus meds, it's like, oh, well, let's take 1,500 milligrams of this a day. And we're like, he's like, it's making you sicker. And, but at the same time, it's like, well, do you just go ahead and stop certain lupus treatments?
Right.
You know what I'm saying?
Right.
I mean, I get it because he doesn't take medication besides high blood pressure. So he doesn't really understand all of it.
Oh, yeah.
But I get what he's saying. And that's where I'm like, okay, I've got to take my life back. I can't really do a whole lot of physical things you know, I lost like 16 pounds like at the beginning of the year because I did paleo. But then I think I had my epidural, and that was when you're gone. And it's all back.
Oh, no.
So that's why I was like, well, I'm going to just try to start back. I don't have hot tamales right there, but I'm like, I got to go back on the paleo and at least the food part.
Oh, you and I both, so I've been trying to go back on paleo for years now.
But it works. It really works. Though, I mean, my flares were not as bad. Like, it helped. Yeah. And I ate more fish than any other kind of, because I'm not a red meat eater anyway. So, I mean, it worked. It's just
for you.
Finding the time.
Yes.
Because when you're doing it by yourself, it's like, you know, and everybody's like, you need to meal prep. And I'm like, you know, some days it's a struggle just to get by the stove to even cook. So, meal prepping, I get, but I guess I need to just pipe down and just do it.
I give you so much credit. I do. I really, really do. Well, let me get, do you want a refill of this?
Yeah.
Do you, and how many refills would you like? Meaning, how far should we stretch out the next appointment?
So I can cancel. I think the other one I had was the week I come back from my trip. I don't know. You want
me to look it up?
Yeah, I think it's
look here.
5th or 6th. I can't remember.
It looks like the 14th of.
Oh, it's the 14th
of August. Yes.
Should we
keep that appointment?
We can.
That's in about a month.
Yeah.
Okay.
That'll work.
Let's keep that then, and I'll just give you 1 month supply. Will that be? Yeah, that should be enough. Mm-hmm. You've got several in there. How many per day do you think we should do?
I don't say no more than twice a day.
Okay.
Because this one was like every 6 hours, and I never did it.
Yeah. All right. So we'll do 60 tablets, and you can fill it anytime after today. Does that sound good?
Sounds good.
All right. Very good.
And I still have this. Well, these are the only Percocets that I have.
Okay.
So if I'm in a bad spot, do I need to do this for flares or not?
Technically, I wouldn't.
Okay. So can I put it in a sharps container?
So we actually have. I'll give you a handout. You can dispose of it in the trash by scratching your name off and putting used coffee grounds in with it.
Okay.
And you can throw it away that way. Or there are pharmacies that have take back.
Okay.
That you can just take it and drop it off with them, and they'll dispose of it.
Okay.
So I'll give you a sheet that has all that for you. So I'm going to discontinue amitriptyline here. Reason causes kidney pain. Alright.
So what other options are there for the neuropathy? Like, I know I did gabapentin, but it caused weight gain.
Yep, and the pregabalin or the Lyrica is the same.
Yeah, I just deal with it.
I'd really see what this medical marijuana has to offer. Yeah. Because I think it could be a good option.
Okay.
All right. I'll get these new prescriptions back for you shortly.
Thank you.
All right. My pleasure.
I like your haircut.
It's short, isn't it?
It's good. Less maintenance.
It is. It really is. But it's one of those things, like, you get done, you're like, whoa.
It's like, I didn't really mean for you to cut that much off.
Exactly. But it grows.
It fits your face.
Well, thank you. I appreciate that.
All right. Have a good day.
You too. Take care, okay?
Alright guys, so I'm done at the doctor. I did record, so hopefully, pretty sure the footage is good. We changed my medications to what we needed to. I'm gonna get back on the pain cream. I'm gonna call medical marijuana place. There's a second one here in my city. First it was just that one, which I told you guys was like $500 to $700 a month, and nobody got money like that. So I'm headed to the bank right now to make a track deposit, and then I'm got to go by probably the dollar store to get some plug-ins for our Glade plug-ins, and then go home and get to cleaning. I need to take my medicine. Like, I brung cereal and I ate that. but I did not bring my medication for the morning, and it's almost 12 o'clock. So yeah, I'll come back.